Are you curious about those advertisements that you see on TV for Medicare plans that have a $0 monthly premium? Have you been wondering if this type of plan might work for you? Well, stay tuned because I'm going to give you 5 reasons why this might be a good choice. Hi, I'm Shauneen Sullivan, founder of USA Medicare Plan, where we help people on Medicare find low-cost options for Medicare supplement and prescription drug coverage. You may have been told that Medicare Advantage plans are bad or they're not really free and you should stay away from these plans. Well, the truth is that there are pros and cons with every type of plan. For some people, Medicare Advantage can work very well. Let's talk about why a Medicare Advantage plan may make sense for you. Number 1, if you're a healthy individual and you don't have any serious health conditions or a family medical history of chronic disease, you don't see the doctor very often and you haven't had to spend a lot on medical care. Number 2, if you don't do much traveling outside of your local area, you don't have the need for nationwide coverage. Number 3, you don't mind having to see doctors and providers inside a plan network. You're satisfied with the list of providers to choose from. Number 4, you want to keep your monthly costs low. You don't mind paying for medical services as they occur, and you'll take more risk for any out-of-pocket expenses that could total up to the annual maximum on the Advantage plan. Number 5, you would like to have your benefits bundled into one plan, and you like the idea that you may be able to get some extra benefits with your plan, such as dental, vision, or a fitness membership. You're willing to pay more for the other services to have these extra benefits. If you agree with all 5 of those criteria, then Medicare Advantage may be a good fit for you. Let's explain in more detail what Medicare Advantage is and 2 popular types of plans. Medicare Advantage is called Part C of Medicare. These are private health plans that are tightly regulated and funded by Medicare. You're still in Medicare. The only difference is that the plan will be administering the Medicare benefits. All claims are filed with the insurance company, not through Medicare. It's similar to any group plan that you may have had while working. This is a bundled type of plan where you'll still need Part A and Part B. One important note, you'll still need to keep paying for your Part B of Medicare even if you choose Medicare Advantage rather than a Medicare supplement. Medicare Advantage is not a Medicare supplement. You can have one or the other, but not both at the same time. The most popular Medicare Advantage plans are the HMO and the PPO. The HMO typically has the lowest copays. The HMO includes a network of providers and they don't include out-of-network benefits. If you go out of the network, you'll have to pay the bill. They're regional plans, which means you must reside in the service area to be able to enroll in this type of plan. You also may need a referral from your primary care doctor in order to see a specialist. With the PPO, the copays may be a little higher, but you have more freedom to see providers outside of the network. You may have to pay more if you go out of the network, either a higher copay or a percentage of the bill. And with a PPO, you don't need a referral to see a specialist. With either plan, emergencies are always covered anywhere, but you may not be covered for ongoing care until you get back to your network area. So you want to make sure you check the service area before enrolling in your plan. Even though you may find a Medicare Advantage plan that has a 0 premium per month, this doesn't mean that all your medical costs will be 0. You may have no or very low copays for some services, but unless you qualify for government assistance, you need to know that almost all the plans have costs that you may be responsible for, such as copays for tests, surgery, and for each day that you're an inpatient in the hospital, up to a certain number of days. The good thing is there's an annual maximum out-of-pocket on each plan that puts a cap on the total amount that you could be billed. Most Medicare Advantage plans include Part D prescription drug coverage, and sometimes there's extra benefits included in the plan, such as dental, vision, health and wellness products, and gym memberships. It's important for you to know that benefits can vary from plan to plan, and also by the county where you live, so not all types of plans may be available in your area. This is something that we can help you with. We have access to all the plan options nationwide. So a Medicare Advantage plan can make sense for some people. We have clients in both types of plans. It just has to make sense for your situation. I hope this video has helped you understand how Medicare Advantage works and if it may be a good choice for you. If you like this video, please give it a thumbs up and be sure to watch our other videos to help you better understand your Medicare.